Good evening and namaste everyone. At these alarmingly increasing conditions of COVID-19, any ventures or efforts to contain the situation seems to be too paltry. The symptoms being the common conditions such as fever, cold, cough, sore throat, and so on, and the very transmission is the virus is through nose and mouth. When everyone is crying out to avoid touching eyes, nose, and mouth, here's a person who still keeps touching eyes, nose, and mouth, not of hers, but the patient's, as she is into the Department of Eye and ENT. So we have with us today Dr. Sandhya Rani, Associate Professor at JSS Ayurveda Medical College and Hospital, with a rich clinical experience, who is the very right person to tell us about how to take care of the eyes, nose, throat. Doctor, I welcome you to this Facebook live presentation. Please.
Thank you, sir. At the outset, my humble pranamas to His Holiness Sri Shivratri Deshikendra Mahaswamiji and my sincere regards to Jesus Mahavidyapita and the Forum Center City for giving me an opportunity to share my views in this platform. The outbreak of COVID-19 has created a global health crisis. In fact, the coronavirus gains its entry through the nose to our body. The primary symptoms being, as you told, the runny nose, the dry cough, the sore throat, a fiery red eye leading to conjunctivitis, headache, later fever, and later difficulty in breathing. These conditions require management through hospitalization, as it may become fatal. It is important to take all the precautionary measures to avoid such health issues. So our nasal cavity comprises of hair follicles and mucus secreting glands. These are the body's first line of defense mechanism against harmful organisms. These hair follicles trap the dust, germs, and other organisms and will filter the inspired air. See, this is the God's gift to all living beings. In Ayurveda, there is a concept called Pratimarshanasya, wherein we need to apply 2 to 3 drops of medicated ghee, oil, to our nose before going out of the house. In fact, it is a day-to-day practice that everyone needs to follow it every day. It forms a coating over our nasal mucous membrane and will not allow the organisms to get into our system.
I think people remember our Prime Minister, while addressing the nation over COVID-19 and in his 7-point appeal to follow the Ayush guidelines, one was applying coconut oil in the nostrils, and the very reason was to prevent the entry of the virus.
Yes, exactly. And not only the virus, but to prevent other conditions like allergens, which enters into our nasal cavity. So, and it will protect allergens to enter into our system, and hence we can protect ourselves from allergic rhinitis and other respiratory issues. The practice of this type of Pratimarshanasya every day is very much beneficial in such patients.
Correct, madam. This COVID condition has many impacts, and it has brought the much mandatory situations of depending on the gadgets. So, how these things are going to can affect the eyes?
Yes, exactly. It's a very proper question at this moment, sir. See, before the onset of COVID issue itself, the people were so much addicted to mobile phones that they used to see the mobile phones as soon as they wake up in the morning. They doesn't interact with the people whom they meet, but instead they'll be looking into the mobile screens. And the recent fashion is they're not greeting their parents or friends personally, but instead they'll just go through the social medias or like mobiles or apps like WhatsApp or something like that. And at this situation, people have become very much crazy and dependent on these electronic gadgets for their requirements, either maybe entertainment, employment, or for education. This mandatory dependency will certainly have larger impact over organs, especially the eyes. Eyes gets strained with irritation, dryness, and those who are having spectacles need frequent changing because of the rapid change in their power. People who are already having any refractive errors like myopia, hypermetropia, these are the conditions wherein the person or the people find it difficult to see near and far objects accordingly. And at this juncture, I just wanted to highlight one important factor here is there is a condition called computer vision syndrome, or otherwise we call it as dry eye syndrome, wherein the person who works in front of the system for hours gets eye strained because of the computer display. Due to the constant exposure to the radiation that the screen emits, their eyes gets dried. The tear film in the eyes gets dried and the person feels eye strain and blurred vision, redness of eyes and headache, and the person is unable to concentrate on his routine work. Hence, it is very much important to protect the health of the eyes.
Madam, what are the general precautions that may be taken to protect our eyes?
Yeah, sure. There are certain precautions which we all need to take care, and not only in this situation but even in the routine also. Do not rub your eyes. Avoid wearing contact lenses. Instead, go on for the spectacles. Why I just am highlighting on this point, because the contact lenses acts as foreign body to some individuals and they may develop itching sensation or any other allergic reactions. So when there is allergic reaction, they start to rub their eyes frequently. To avoid unnecessary interference, we need to switch on to the spectacles, especially at this time. And another one important factor is those who are using system for hours together, either for employment or entertainment or any other purpose, should take frequent breaks in between the sessions and intentionally increase the blinking rate. There is a study that which says the person who works 1 hour in front of a system will reduce 50% of his blinking. So this blinking is very much essential to rejuvenate your eyes, the tear film or the lubricating activity. And if anybody is feeling the dryness, a sort of dryness, then they can use some of lubricating drops or just a water wash in between the work schedule will help the purpose. And frequent intake of water will also help to protect their eyes from dryness. Nowadays, you are getting the anti-glare glasses and anti-glare screens, and even in mobiles also there is an eye protection option. You better choose all these so that you can protect your eyes. And while working in front of the system for a certain period, the proper room lighting is very much important. The brightness of the display, the contrast, and the position of the system also matters a lot. For all these issues, there is a simple technique in Ayurveda which helps to rejuvenate our eyes. That is called as palming. First, you need to just clean your hands with a gentle soap, pat it dry, then gently massage your hands till it becomes warm, and then gently just put this part of your hand over the eyes like this, and for 2 to 3 minutes, you can just put a gentle pressure over your eyes, and this will rejuvenate your tear film and helps to relieve from the dryness. Another one important thing I want to highlight here is, generally you might have observed the ladies used to apply kajal for their eyes. It is not just a cosmetic purpose or just to beautify themselves. The scientific reason behind this usage of kajal is it improves the eyesight and helps to protect the health of the eyes. Another one important factor where Ayurveda highlights is padabhyanga, or the foot massage. By massaging the foot, some of the acupressure points are there directly which are connected to the eyes, and they help to relieve the eye strain and the redness. So these are some of the tips which you can follow and which our viewers can follow to take care of their eyes.
Correct, ma'am. These are the you can say general and very simple preventive measures that people can follow. And with people who are at the high risk group, particularly with the diabetics. So they need much more information. Can you give some more information for protection of the eyes in them?
Sure, doctor. Though diabetes is said to be a multi-systemic involvement, one important complication arising out of this diabetes is nothing but the diabetic retinopathy, where the innermost layer of the eye, that is the nervous layer, that is the retinal layer, gets damaged, and even the retinal blood vessels are affected, leading to progressive hemorrhage and leading to progressive vision loss, and ultimately there may be blindness. We usually say this diabetic retinopathy is a silent complication of uncontrolled diabetes, and it is one of the preventable blindness. The person will not come to know about that he is suffering from diabetic retinopathy till it reaches an advanced stage. Because from the front or from the appearance, the eye looks very much normal. There is no other symptoms except there may be mild blurriness of vision, that is, he cannot see properly. Floaters are the things that some mosquito-like objects or things moving around in their visual fields in front of the eyes. Dark areas in the visual field, that is our black patches over the visual field. Poor night vision. They find it comfortable in the daytime. There is no problem with the day vision or in a bright light. But when it becomes dark or when it goes dark, they find it difficult. Then there may be fluctuating and distorted vision. This distorted vision is nothing but the street objects appears very much zigzag or in a wavy pattern. So these symptoms are very much vague, and the patient will not identify whether these are the symptoms of diabetic retinopathy or it's just a mere eye strain. So it is very important to have a routine eye checkup at least once a year, so that your doctor can identify these early symptoms and can be treated as early as possible. If we treat this diabetic retinopathy in early stage itself, definitely we can give better results. This condition is effectively managed in our hospital with some of the treatment modalities. So one of the very important factor here is the virechana. Virechana is nothing but a body detoxification through purgation. It's a Panchakarma procedure that we follow in our hospital, which helps to take off the cloggings in the minute arteries of the eyes. The special treatments such as Shirodhara. Shirodhara is a procedure wherein the medicated kashayas or the decoctions or processed buttermilk or the oils are poured over the forehead for a stipulated time. So this procedure improves the arterial circulation in the eyes and prevent ischemic changes, and it removes the arterial blocks, and bleeding can be reduced by these type of procedures. And especially for eyes, we do have certain special treatments like Netra Seka and Netra Tarpana. Netra Seka is a procedure in which the medicated decoctions are poured over the closed eyes for a stipulated time, like for 15 or 20 minutes for a period of 7 to 8 days.
Yes.
We'll be doing that, and with that definitely the circulation over the eyes will be improved. Netra Tarpana is again a special treatment for the eyes, wherein the medicated ghee is made to stand or allowed to stand in the closed eyes, and patient is asked to blink over it for a stipulated time, and for a certain days, like 7 days or 10 days, we are doing this. By these procedures, eye treatments, it rejuvenates the retinal layer, which is nothing but the nervous coat of the eye, and thereby it prevents the degeneration of the neurons which are there in the nerves, which are there in the retina. It also checks the further progression of the disease and can delay the loss of vision. We can just drag the disease, and we can postpone the loss of vision. It's not just the diabetic retinopathy alone what these procedures will help, but even in healthy individuals, these treatments are done to protect the health of the eyes.
Ma'am, this COVID-19 has a multitude of impacts, such as, on the working patterns, jobs, or even financial aspects. So these may cause, tensions or stress and in effect the sleep patterns as well. So which can even bring headaches and all. So how to prevent or manage these conditions?
Yeah, you have rightly asked this question, sir. When people heard about this coronavirus at the first, they were curious and they were curious to know about this virus. When it started picking up, when they were hearing the news about that this much have get infected and all, they become anxiety. And when they were facing this lockdown and other series of the events, then they were stressed. People become tensed because of the insecurity of their jobs, change in the work pattern, financial crisis, or family issues, and the list just goes on. Such people get stressed because of the boredom or emptiness. Because all of a sudden they become free. The busy people, all of a sudden, they just become free, and they may have stress in their minds, and that might have induced a stress headache. Stress, of course, is the major cause of all kinds of headache. People who are constantly into the tension will suffer from tension type of headache. Another most common type of headache is nothing but the migraine, which most people suffer from. Even though the stress is one of the major cause of migraine, but even the added points or the risk factors may be the irregularities in the food pattern, major of the spicy or irregularities in their sleeping patterns adds up to this condition. In such condition, people experience pain in half side of the head, or there may be complete headache with nausea. Nausea is nothing but the vomiting like sensation. They may not get vomiting as it is, but there is a sensation of vomiting, and gastritis, and sometimes even vomiting itself. Blurred vision, and there may be giddiness or the dizziness they may feel in some patients. Another one important type of headache which we come across is nothing but the sinus headache, wherein the patient gets heaviness of head, and this is usually seen in patients who suffer from common cold almost all every season. And this type of headache is seen in patients who are exposed to cold atmosphere, and allergy condition also will give rise to sinus headache. We in JSS Ayurveda Hospital treat effectively these type of headache with certain treatment modalities. As we have discussed earlier, the Shirodhara is one of the very beneficial or effective procedure even in any type of headache. Another one important therapeutic procedure what we are doing in our hospital is nothing but the Nasya Karma, where medicated ghee or oil or any even herbal extracts are installed into the nasal cavity with prior gentle facial massage and followed by steam.
Ma'am, these are the things which manages the stress and headaches. As the entry of the virus is also through mouth, what are the precautionary measures that one can take in the oral hygiene?
Yes, let me explain to you. Mouth is one of the common route of transmission of organisms that you know. So we need to take care of certain precautions to avoid the invasion of organisms through mouth. The entry of organisms through mouth leads to the condition, as you know, sore throat, recurrent tonsillitis, pharyngitis, and so on. Some of the preventive measures what here we can take is nothing but the practicing the Kavala and Gandusha, which will prevent the entry of the organisms. Let me explain to you. Kavala is a procedure in which the medicated decoctions or the oils are gargled in the oral cavity, which helps to cleanse the oral cavity and kills the germs, the harmful organisms, and prevents the infectious conditions. Gandusha is a procedure wherein the oils or the herbal extracts are held in the mouth for a while, and this helps to strengthen the structures which are there in the oral cavity, for example gums, the teeth. By this we can prevent the gingivitis, the recurrent infection of the gums, and the caries teeth, and the decay of the tooth can be prevented from all these procedures.
Ma'am, we were talking about the effects of overusage of gadgets, and we saw its an effect and also the management when it comes to eyes. And as these can also affect the ears, what suggestions you would like to give to prevent the effects or the overusage of the gadgets?
Certainly, sir. Even during the lockdown or even otherwise also, people used to use the earphones or the mobiles constantly, and the younger generation especially, they just use this mobiles or the FM radios and listening to the music constantly.
Most of the time.
Yeah, most of the time. When they feel free, they just switch on to the music and continuously they'll be listening. This or even due to sound pollution also. These things damages the structures which are there in the inner ears, and they may just end up in problems like tinnitus. Tinnitus is a condition wherein the patient hears a ringing sound, a sort of sound or a huzzing sound or a sound of any worm, or patients will specifically tell the sound of a moving train or something like that, which the patient feels or hears in the absence of actual sound. So this is really alarming, or it is a very much disturbing for the patient, this type of symptoms. Next, another one important impact of all these things is nothing but the hearing loss. It may be mild, where the patient just go unnoticed, and the patient will not hear the minute sounds by this. When it becomes moderate and severe, they definitely will have certain problem either with their work schedule or maybe at the family level. Other conditions like vertigo or the dizziness imbalance is caused because with the inner ear, that is the vestibule, when it gets affected, the dizziness or the vertigo will occur. These things can be managed through Ayurvedic treatments, that what we do in our hospital. Usually, regularly, we just do these things. One of the important procedure what we do is the Karana Purana. It is nothing but the ear filling. We are using the medicated oil, especially in this procedure. Oil are just filled into the ear,
Yes.
and will make it to be there for a certain time, like for 10 minutes or 15 minutes, depending on the condition of the patient. Even the drugs or the oils are selected depending on the condition and the disease progress or the state of the disease in these conditions. And later, these oil is taken out by the dry mopping method, and will just clean the ear, and the patient is asked to just take their
We
routine
even
duty.
using earbuds and all.
We are not using earbuds here.
Okay.
It's contraindicated. We'll use just a plain clean cotton, and we'll just take out the
Okay.
oil. We conduct these therapies at our hospital regularly, and we take all the precautionary measures to prevent the cross infection from patient to patient or at this COVID situation. And here you are, Dr. Krishna Prasad, being the HICC chairperson, will brief on the measures
Yes.
that are taken at this juncture.
See, our JSS Ayurveda Hospital, being the government recognized hospital and CGHS empaneled one, and also the NABH accredited one, we follow all the hospital infection controlling measures here. And at this point of time, especially the COVID situation, we have a special screening for COVID, wherein we do it for everyone who enters the hospital, and right from the health workers, patients, and even attenders. And we do a thermal check, and we have provided personal protection. I mean, what we call personal protection equipments to everyone, and hand sanitizers is kept everywhere. And we do fumigations as per the Ayurveda classical text, and we do sterilizations, and we ensure that we provide an infection-free atmosphere at the hospital. And we do give decoctions to everyone as a prophylactic measures. And at our hospital, we also have the health insurances coverages. More than 25 companies, are giving these services in our hospital. So, thank you very much, doctor, for all the invaluable inputs for the maintenance of the health of the sense organs.
Okay.
And before we wind up, we have some questions from the viewers, ma'am?
Yeah, sure, sir. I'll be very much happy to answer these questions.
Thank you. Like there's a question. There are the symptoms, such as redness in the eyes. What are the other features of the conjunctivitis? Because the redness is also appears in the COVID-19 symptoms.
Yes, while describing the symptoms of the COVID-19 only, we were just discussing that there will be a symptom like red eye. There are so many conditions, the people may not have any other symptoms other than just a fairy red eye. That may be one of the symptoms of COVID-19 also. Apart from it, even in other type of conjunctivitis, there are so many varieties of conjunctivitis, maybe allergic, bacterial, viral, so many other type of conjunctivitis. It is nothing but the inflammation of the conjunctiva, which is what we are seeing, the white part in our eyes, that we just call it as conjunctiva. When it gets infected by organisms, maybe bacteria, virus or allergens, that will just cause irritation in the eyes. Because of that irritation, the patient feels like rubbing the eyes, there is redness, there is discharge, it may be a watery or it may be a pus discharge, purulent discharge, what we call it as. So, and there may be pain around the eyes, even the headache. These are the symptoms usually the conjunctivitis presents. And I just wanted to highlight a point here. The mere conjunctivitis will not have any other symptoms, like there will be no sore throat, there will be no dry cough, other symptoms will not be there. But in case of COVID conditions, even there may be increased body temperature or any respiratory symptoms the patient may experience with. For this, better if any patients, those who are having such symptoms like redness of eyes or there is irritation in the eyes, better to have a checkup with their ophthalmologist so that they will tell whether it is because of COVID infection or it is merely a bacterial or a simple allergic conjunctivitis.
Yeah, thank you, madam. Like there is another question. Now, can we apply eucalyptus oil under in the nostrils to prevent this catching of infections?
Yeah, definitely. This eucalyptus oil, or that's what Nilgiri Taila, what we in local language we just tell. Definitely, it is going to help to prevent any organism, maybe the allergens or the virus or the bacteria. Because I have already explained to you, our nasal mucous membrane is having the hair follicles and the mucus secreting glands.
Yeah.
This eucalyptus oil will form a coating over that mucous membrane and definitely helps to trap or to adhere. It makes the organisms or the allergens to get adhere there, and it will not allow these organisms to get inside our system.
Correct. There is another question, ma'am. Like, are there the treatments available for eyesight problems in Ayurveda?
Sure, definitely a very good question, because nowadays, the school-going children are facing many difficulties in their vision. And the main cause may be, it may be a hereditary one, or it may be acquired, as we were discussing, because because of the lockdown or because of this COVID infection, the school's pattern, the teaching pattern has changed. Yeah. From blackboard to smart boards, all have become, they'll be teaching through online classes or even through the recorded version of the classes they are doing the education system. These all things will have a definitely impact over the eyes of the children, because the children eyes are very tender and they need rest, as we say. So usually this refractive errors, what we mean is nothing but the myopia, hypermetropia or astigmatism. We term it as timira in our science. In Ayurveda, we just call these conditions as the timira, and in such conditions we do treatments. Many eye treatments are followed, and our hospital is having specialized treatments with a mild body detox treatment especially for children, and later we will follow the eye treatments like eye wash. We do eye wash with our medicated decoctions, and we do eye exercises for it, like palming, sunning, and ball exercises, bar exercises. These are the exercises which helps the muscles which are there around the eyes to help they just get toned up and helps for broader accommodation, and the person or the child or the children will have a clear vision.
Okay.
But it is a thing I have to highlight here is there is some limitation. Don't think that if the baby is having -6 or -10 of his power in the eyes, we cannot, or any other system cannot make it to 0. It's very difficult. In a long run, we can reduce the conditions or reduce the power of the eyesight, and we can check the further progression of the power and even the other symptoms like redness. And when the progress of this power goes on, there may be diplopia, that is double vision. The child may have a double vision or distorted vision. That's what I explained. The straight objects appears very much slanting or in a zigzag manner, and they get eye strain very soon. So these conditions can be prevented by our eye treatments like Netra Pindi, Netra Tarpana, Netra Seka, and Anjana Prayoga, and eye exercises.
Ma'am, there is a question on tonsillitis. Why people usually suffer from repeated tonsillitis, and how to prevent these recurrences?
It's a really very good question, because even in our OPDs we used to see this recurrent tonsillitis very often, and even children also will be get affected with tonsillitis, and even equally elders are also get affected with tonsillitis. The main reason behind this tonsillitis is nothing but the nasal block. You may be wondering why the tonsils are in the oral cavity and why madam is telling about the nasal block and all. See, our breathing or the nose is specified for breathing. You need to have nasal breathing always, because I told you there are filters in the nasal cavity. But when you breathe, when there is nasal block, when there is obstruction in the nose because of the allergy, because of the infection or a common cold or a DNS, that is the deviated nasal septum, then the patient cannot or the person cannot breathe through their nose. Then they go for oral breathing. Oral breathing is nothing but they'll be breathing through their mouth. They'll not use the nose. But the thing here is, in the mouth we do not have the natural filters. So the organisms or the bacteria, what we are inhaling constantly, they will just attack the tonsils, which we usually tell they are the bodyguards of our body. They just get infected and they become swollen, they become inflamed, and try to check the infection going into our system. So they just guards, they become inflamed and they just guards our respiratory system so that it is not affected much. That's why for the recurrent tonsillitis, it is the nasal thing which we need to correct it. And for that, as we have already discussed, Nasya Karma or the Prativarsha Nasya will serve the purpose.
Okay, thank you, madam. I think this particular viewer, I think he or she has missed your initial speech or presentation.
Okay.
Anyway, there is a question on migraine. Are there treatments available for migraine in Ayurveda?
Sure, migraine is one of the very popular or very much common disease usually the patient presents with. In India, when we take the statistics, so if 100 persons are getting headache, more than 70% of them are prone for this migraine. And migraine, there are varieties of migraine. There are conditions like migraine with aura, migraine without aura. And there is another very peculiar feature of migraine is there will be no pain, but the patient will have hallucinations, they will have visual disturbances. Even this is not a problem with the eyesight, it is a problem with the nerves which are there in the cranium or the head or in the brain. So usually we take such cases, there is a migraine treatment, specialized treatment packages we do have in our hospital, particularly for migraine. In this condition, we assess the prakriti of the patient, we'll see their food habits and what is the cause for migraine, whether it is a stress or variation in their food habits or sleeping patterns. People, they used to get stressed because of the pity things, So in such condition, we need to evaluate what is the real cause of this migraine and there we are just going to analyze it. The cause we need to analyze, and treatment accordingly is given. As a whole, we are doing a body detoxification procedures. Depending on their condition, again we'll select whether it is Vamana Karma or a Virechana Karma or a Nasya Karma we need to go for. And even in Ayurveda, there are specialized treatment, especially for migraine, like there is a Agni Karma. Agni Karma, you may be wondering by hearing this, it is a procedure wherein a sight of a small sparkle of a heating procedure is done. Usually over the eyebrows, we call it a supraorbital area, and Agni Karma is done a particular site, so that the nerves will be stimulated and the blood vessels or the blood circulation will be improved with these procedures. And we also practice the dhyana, yoga, pranayamas, so that their mental status can be corrected as far as possible.
Thank you, madam. There's another question on the nasal polyp. Is there a treatment for nasal polyp in Ayurveda?
Okay, fine. These nasal polyps are nothing but the mucous membrane which are dragged from the sinuses. Those patients who are having frequent sneezing or frequent allergic symptoms, they will have this nasal polyp at the end as a complication of allergic rhinitis or DNS, what we call deviated nasal septum. So what happens in them is the mucous membrane which is there in the sinuses are dragged downwards, and they will become a pedunculated mass-like structures. They are actually non-inflammatory, but they cause nasal obstruction to maximum extent that they cannot speak from the nose, because one of the important function of the nose is to give resonance of voice. The voice clarity is given by the nasal cavity. If the cavity is clear, the person can speak clearly. You might have observed those who are having nasal block or at the time of common cold, their voice is not so much clear. So when the person is having this nasal polyps, their voice is also disturbed. They will be getting what we call it as anunasika walk, or the nasal speech, what we just usually tell. In such condition, we do have treatments in Ayurveda. Again, here also, first as a first line of management, we do a Shodhana therapy or the purificatory procedure, either by Virechana or by Nasya Karma, and then we are following Kshara Lepa. Kshara Lepa is a procedure wherein the alkalines are applied to the polyps or to those masks, and for 1 or 2 seconds, and immediately it is washed with a water or a normal distilled water, so that this Kshara Lepa will allow this mucous membrane to get shrink and will make a space in the nasal cavity.
Thank you, madam. There is another interesting question. I can say an over-enthusiastic question, probably. Can Anjana, or applying collyrium, help prevent COVID-19?
As such, COVID-19 is a virus, isn't it? So when we use Anjana or the collyrium or the kajal, what we are usually practicing, it will have the immunity inside our eyes itself. If you are practicing daily, definitely your eyes, that is the lacrimal tears or the organisms or the immune system of your body, try to prevent or try to neutralize these viral effect. But if you are applying on the day of infection, definitely it may not, because in a long run, definitely your immune system will be boosted. And we have got a concept of Prayogika Anjana, that is daily practice of Anjana is very much beneficial, not only to prevent any infection, not only the virus, not only the bacteria, not only the allergic condition, even any other dreadful eye diseases like diabetic retinopathy or the retinal detachments or any other ARMD, that is age-related macular degeneration. These things can be avoided or can be prevented by applying Anjana. And here also the selection of medicine again plays an important role.
Okay, there's another question who says, my grandmother used to say put lot of mustard oil in the ears.
Yeah.
So I mean, he was worried, and he's asking whether it clogs the ear or will it help?
First, I want to just highlight a point here, sir. Those who want to practice this ear filling at home, better to have a ear checkup from your ENT specialist, because we don't know what is the condition in the ear. There are conditions like tympanic perforation, that is what we call it as eardrum in a common term. If there is a hole or a perforation in the eardrum, definitely you are not supposed to do this ear filling. That's why what I advise my viewers here is better have a ENT checkup prior to all these practices. When you came to know that, or when you get your ear confirmed that there is no such issues, there is no issue of eardrum, or there is no infection, even at the time of infection when there is pus discharge in your ear, you are not supposed to put the oil in the ear. It may flare up, because we don't know. The organisms may just develop more in the this oily or fatty media. So that's why I suggest our viewers not to take risk. First, they should have a prior ENT checkup. If they find that there is no issues with the eardrum or the tympanic membrane, then definitely they can use sesame oil, coconut oil, or merely any edible oil are also very beneficial to improve their hearing capacity, because this oil filling helps, as it is a nervine. It improves the nerve's capacity. The auditory nerve is there and the vestibular nerve is there. These auditory and vestibular nerve has got typical function, the two prior main function of the ear, that is, one is the perception of the sound or the hearing, and another important function is the maintaining the body equilibrium. These things can be managed very effectively if you are doing this oil filling in the ear.
Thank you, madam. There's another question. Probably they are also, given the symptoms which they are suffering. Say they have a headache in the back of the head, in the base of the skull, and half headache sometimes, and there's a pain behind their eyes, and they have this light sensitivity
yeah.
And also pain in the movement of the neck. So probably I think they are talking about this occipital neuralgia. So they are asking whether there is a treatment available for this occipital neuralgia conditions.
Definitely. When you told, or when the person is telling about the occipital headache, there are again here 2 or 3 conditions where we need to look into before going for a treatment. Occipital headaches are usually seen if it is a child. Then you have to evaluate the vision of the child. Usually what happens, our eyes since morning, they'll be working. They'll be doing the visual perception, and visual center is there in the occipital lobe of our brain, which is situated in the backside of our head. Since morning, we'll be visualizing the things and our eyes will be doing their function. By the end of the day, the visual center gets strained and there may be occipital headache. If such is the condition, if the person is getting at the evening hours, better to go and have a vision check done, so that they'll come or they'll get to know their vision condition. Another one important condition where usually the person will get an occipital headache with pain in the back is the position or the nature of work what they are doing. Like in cervical spondylosis, if they are always sitting in front of the system working with the laptops, or with like bank employees since morning, or the IT professionals, because of the posture they may get this type of pain. Here also we do so many treatments like Nasya Karma, again here also we follow, and with that a specialized treatment we do have particularly for the neck pain, that is nothing but the Griva Basti we call it as. So here medicated oil is made to stand or made to allow to stand in that particular place where exactly the person experiences pain for a stipulated time, and then a gentle massage and steam will just serve the purpose. The local nerves or the nerve endings, the pain receptors, will be stimulated, and the gentle massage will improve the blood circulation, and thereby the pain may be relieved.
Thank you, madam. There is another question.
Okay.
It's probably on the computer vision syndrome. So, someone has keenly observed your presentation, and he's asking, ma'am, there are two contrary symptoms, observed in this. One is watering in the eyes, and there is dryness as well in the eyes. There are two opposite symptoms. Why is this?
Exactly. I was expecting this question when I was supposed to tell you about this computer vision syndrome, and otherwise we call it as dry eye syndrome. See, our eyes are designed in such a way that there is a lacrimal apparatus, there is a lacrimal gland, lacrimal secretions will come from the lacrimal gland to our eyes. It forms a tear film over the eyes, then lacrimal puncta, lacrimal canaliculi, through which it is passed out of the eye. This tear film will give the lubrication and the required moisture effect to our eyes so that we can blink, we can see, we can do our routine activities. When there is eye strain, when the person starts to work for 3 or 4 hours per day in front of the system, so what happens? Our body, by the defense mechanism, the lacrimal apparatus or the lacrimal glands secretes more of tears so that those ill effects are neutralized, those ill effects are washed out. That's why the person experiences watering of the eye at the initial stages. But later, and after some months or after some days, they may have dryness, a sort of dryness, because at a particular time the lacrimal apparatus stop functioning. I just remember a thing here. Usually in our local language, we just tell we usually tell.
Correct.
By crying or by over tearing or by over lacrimation, the secretions are stopped. They just don't secrete. They will just stop their function. So that's why we do have this contrary symptom in computer vision syndrome.
Okay. Thank you very much, madam, for all the your invaluable information, and once again for your time also. Thank you.
My heartfelt thanks to JSS Mahavidyapita, Forum Center City, for giving me a platform to express my views about the eye and ENT protection at this juncture. I also render my sincere thanks to our director, R. Mahesh sir, our principal and MS, Dr. Rajesh Vitkudi sir, and Dr. Krishna Prasad for being a moderator for me. I also thank Srimati Nandita Shanai, our administrative officer, and the technical staff for their constant support in making this event a successful one. Thank you one and all.
Thank you.